I will be honest that we're still figuring out how to use this as an assessment tool. I'd say right now there's a whole lot of formative assessment that happens in here, and that happens during the debriefing that we do. In terms of summative assessment, we use the simulator for some simple, straightforward assessments during our objective structure clinical exams, or our OSCEs, where they're just basically having to maybe pick up something on the simulator and say what they're seeing or what they're hearing. We haven't quite figured out yet how to really do an assessment of their clinical competence with a simulator because it's such a complex animal. And honestly, at the end of the day, we often don't know what the right answer is. We don't know exactly what the ideal way to manage any case is. So providing specific, formative feedback, I think, is really easy in this environment. Doing really critically appraising a student with summative feedback, I think, is a lot more challenging. And I guess from my perspective is not really that important. For me, it's about them getting an opportunity to practice in this room, to learn from their mistakes. I'm not convinced that it's necessarily going to be a fantastic way to assess clinical competence. I think that happens when they're in the clinic. And here we prepare them and give them the confidence to jump in and actually do these things in the clinic when they're faced with real patients.